Rogaine's effectiveness for hair growth. Rogaine, with the active ingredient minoxidil, is a widely used FDA-approved treatment for hair loss. It is available in both foam and liquid forms and is marketed to help regrow hair and slow hair thinning. But does it actually work? Here's a comprehensive analysis of how Rogaine works, who it works for, and what to expect. 1. How does Rogaine work? Rogaine works by reinvigorating hair follicles through a mechanism that isn't fully understood but involves improving blood flow. It widens blood vessels around hair follicles, increasing oxygen and nutrient delivery, shortening the hair follicle's resting phase. It pushes hair follicles into the growth anagen phase sooner, increasing follicle size. Over time, hair grows back thicker and stronger. 2. Who does Rogaine work for? Rogaine is most effective for individuals experiencing androgenetic alopecia, pattern hair loss. Success depends on factors like age, more effective for individuals under 40 years old. Hair loss. Duration. Works best if hair loss started within the last 5 years. Hair loss. Pattern. Best results are seen for crown thinning, less effective for receding hairlines. 3. How long does it take to see results? Hair growth is a slow process, and Rogaine requires patience and consistency. Initial shedding, weeks 2 to 6. Temporary shedding as hair follicles enter a new growth phase. Visible improvements, 3 to 6 months. Noticeable changes in hair density and thickness. Maximum benefits, 12 plus months. Full results become more apparent after a year of consistent use. 4th, clinical evidence supporting Rogaine. Numerous studies confirm Rogaine's effectiveness in treating pattern hair loss. A study published in the Journal of the American Academy of Dermatology found 60% of users experienced hair regrowth after 48 weeks. Other research shows improved hair density and thickness with long-term use. 5. Different formulations, foam versus liquid. Rogaine. Foam. Easier to apply, dries quickly, less greasy, and often preferred by men. Rogaine. Liquid. May cause more scalp irritation due to propylene glycol, though it penetrates better into the scalp. 6. Rogaine for men versus women. Men's Rogaine, 5% minoxidil, more concentrated for faster results. Women's Rogaine, 2% or 5%. Lower concentration minimizes side effects like facial hair growth. 7. Potential side effects. While generally safe, Rogaine can cause scalp irritation, itching, dryness, and flaking. Increased shedding, temporary during the early stages. Unwanted hair growth, possible on the forehead or face if improperly applied. Dizziness or rapid heartbeat, rare, from systemic absorption. 8. Limitations of Rogaine. No effect on complete baldness. Inactive hair follicles won't regrow hair. Requires continuous use. Stopping Rogaine leads to hair loss resuming within 3 to 6 months. Not effective for non-pattern hair loss. Conditions like alopecia areata or hair loss due to medication are unlikely to benefit. 9. Tips for maximizing Rogaine's effectiveness. Apply consistently. Follow the twice daily application for men or once daily for women. Apply to dry scalp. Water can dilute the solution, reducing effectiveness. Be patient. Stick to the regimen for at least 6 months before evaluating results. Combine with other treatments. Dermatologists sometimes recommend combining minoxidil with finasteride for men or low-level laser therapy. Rogaine is an effective, clinically backed treatment for pattern hair loss, particularly for those who start treatment early and stay consistent. While it requires ongoing use in patients, many users experience visible hair regrowth and thicker hair after several months. However, results vary, and consulting a dermatologist can help set realistic expectations and explore complementary treatments if needed.